This series of videos have been developed by Public Health Services. The sessions are designed to provide self-directed learning and cover the basics of infection prevention and control. This session is about waste management and linen management. From this session, you will have an understanding of the appropriate and safe handling of waste and linen in the healthcare environment. Standard precautions refer to work practices that are applied to everyone, regardless of their perceived or confirmed infectious status. They are the minimum level of infection prevention and control. Two elements of standard precautions are waste management and linen management. Appropriate and safe handling of waste and linen is essential to protect patients and those who generate and handle the waste or soiled linen. Waste management includes safely segregating and disposing of waste, while linen management includes both appropriate storage of clean linen and the safe handling of used and soiled linen. I shall discuss waste management first. All Australian states and territories have legislation under their Environmental Protection Act or similar that provides regulations that apply to the management, transport and disposal of clinical and related waste. Most states also provide guidelines on waste management that are based on these regulations. Remember, any legislation and regulations around waste must be adhered to. I would suggest you refer to your state or territory Environmental Protection Agency or EPA to access these documents. These documents will also define what types of waste are classified as clinical waste in your jurisdiction, as the definitions do differ slightly between states and territories. The initial management of waste occurs where it is generated and involves segregating waste into the appropriate waste stream. For example, a newspaper is disposed of into general waste, while a blood-soaked dressing is disposed of into clinical waste. Remember that sharps are considered to be clinical waste, but require a different waste receptacle than all other clinical waste. Also, try and recycle as much of your general waste as you possibly can. Clinical waste is disposed of into yellow bags or bins. These display the black biological hazard symbol and may be labelled clinical waste or biohazard. Dispose of sharps into specific puncture-proof sharps containers. These are also yellow and also display the black biohazard symbol. They must also comply with the relevant Australian New Zealand standards around sharps containers. To protect yourself, wear personal protective equipment or PPE if you anticipate contact with blood or body fluids when you are handling waste. Dispose of waste where practical where you generate it. Always dispose of sharps at the place where you generated the sharp, and make sure you perform hand hygiene after handling waste and after removing your gloves. Linen management includes both appropriate storage of clean linen and the safe handling of used and soiled linen. Clean, unused linen must be stored separately from soiled linen and must be stored in a clean, dry place that prevents contamination by dirt, dust and moisture. Make sure you perform hand hygiene prior to handling clean linen. Used linen must be placed into a laundry receptacle or bagged at the point of generation, taking care to avoid contact with staff clothing and in a manner that does not disperse organisms into the environment. When you're handling linen that is soiled with blood or body fluids, put put on the appropriate personal protective equipment, and segregate and bag the linen where it is generated. And remember to perform hand hygiene after you have handled used linen, even if you were wearing gloves when you were handling the linen. In summary, waste and linen management are components of standard precautions. Safe management of waste and soiled linen is important in preventing staff exposure to potentially infectious blood and body fluids. This session has been based on the Australian Guidelines for the Prevention and Control of Infection in Healthcare. Thank you to the Australian Commission on Safety and Quality in Healthcare for permission to use their standardised infection prevention and control signs.